Welcome to the Protecting Your Nest podcast. This podcast is about understanding the root cause of disease. Most conventionally trained docs like myself are suffering from what my wife calls PMS. So, what the heck is PMS, right? Well, my wife defines it as a syndrome, and those letters stand for procedures, medicines, and surgeries as a way to manage patients' medical conditions, and that's what she feels most doctors are doing. They have PMS and they don't understand it. That's not the way to do it. So in order to recover from PMS, which is what I'm doing right now, it's time to start looking at disease in another way, and that's by understanding its root cause, so that healing and disease reversal becomes possible. Now, that's the approach I believe in. Many of my previous guests believe in that approach, and that's the approach many of you believe in if you're listening to this podcast. And it's also the approach that my guest believes in. So my hope is that as you learn these nuggets of knowledge each and every week, you will have the tools to optimize your health. So to help you along your way, I want to introduce you to today's guest, and his name is Dr. Peter Koz. And Dr. Koz is a functional medicine doc and author of his new book, Unfunc Your Gut: Boost Your Immune System, Heal Your Gut, and Unlock Your Mental, Emotional, and Spiritual Health. His book was acknowledged on June 18th and it just happened to be my birthday, by the way, by the International Book Awards as the winner of the 12th Annual Awards in Health, Diet, and Fitness, and even was shortlisted in 3 other categories. And, in his book, he shares secrets to good gut health and its relationship to physical, mental, emotional, and spiritual health based on research, his experience of addiction recovery, and treating patients in his clinical practice. And it has relatable case studies and 50 delicious recipes that will help us all live well. Simply put, his book answers many of the questions that we are asking about that will help us optimize our health. So, Doc, it is my pleasure to welcome you to Protecting Your Nest.
Thank you so much. It's an honor to be with you.
Yeah, and I appreciate you. And, like myself, you started your journey to be a clinician in the field of family medicine.
Mm-hmm.
And early on, unlike myself, I didn't really discover a different way, like with functional medicine, until more recently. But you kind of took a different path, and you ran into docs like Dr. Mark Hyman and Deepak Chopra. And I think those docs gave you a different perspective of how to approach medicine. So as we get started, let's share with my listeners, how did you find functional medicine, which shifted your focus in terms of how you practice this art? So what led to that?
Yeah. So just complete and total luck. Like I just kind of walked into it and got very, very lucky. It is related to my own personal story of recovery. So um, I'm a first generation American. My parents are from Poland. And my parents are both doctors. I grew up thinking I wanted to be a doctor. And it was a very, very traditional mindset. I went to medical school. I got into residency, and I was just following what the pharmaceutical industry was teaching me. And I thought I had it all figured out. I definitely was suffering from PMS for sure. But what happened on the side was the way that I learned to deal with my emotions, my feelings, my insecurities was through alcohol. So I lived a very much a work hard, play hard life. I would study really hard and then I would party, and it was just this cycle. And when I started residency, I tried to quit alcohol. I tried to give it up from my life. And within a few weeks, I realized I had no idea how to manage life. I had started drinking when I was young, and had done it throughout my life, and I didn't know what to do without it in my life. So I went to a treatment program. I went to a 6-week inpatient treatment program for alcohol recovery. It was for professionals, because my view of an alcoholic was somebody that was like under the bridge, right? Well, this program that I was at, there was doctors, lawyers, surgeons, everybody there. There were all these professionals. And what I learned was I wasn't as perfect as I thought. I thought, I really thought I had it all figured out, and I was kind of walking on the clouds. But I learned that I was actually extremely insecure. And then I had a lot of trauma that I had created from my childhood just through being insecure and always wanting to fit in. That was like my focus in my childhood, is like being an immigrant. Like I always just wanted to fit in. And that's why I drank, right? It wasn't like, that's the thing I learned in recovery is it's not like alcohol is not the problem. There's things that make you drink, right? And so treatment was like full of like yoga, meditation, acupuncture, group therapy, exercise, all these things that were health things that we weren't really talking about in medical school and residency, right? We were just kind of figuring out what pills to prescribe. And so that experience changed my life and just kind of made me more open-minded. I went back to residency. So this was when I was an intern. I went back to residency, and as a family medicine resident, as you know, you focus on different things every month. One month you do inpatient medicine, then outpatient medicine, cardiology, OB, GYN, like you're always learning something new. You have different doctors that are teaching you, and they all have their own style. And we had a doctor named Dr. Batra that every time a patient was admitted to the hospital, when he would come on our service, he would start them on a multivitamin and vitamin D. And he was the only doctor doing this. And we used to laugh at him and make fun of him. Like, why are you wasting our time? Like, why do we have to put in these orders for multivitamin and vitamin D? Like, what a waste. And so post treatment for me, I was back on call with him. It was like Sunday, 2 a.m. in the morning. And it was just me and him. And I was like, Dr. Batra, why are you weird? Why are you doing this? And he's like, well, I'm studying something called functional medicine. And I was like, what is that? And he's like, it's all about the root cause. It's figuring out why people are sick. And so as a resident, they require you, but they also pay for you to go to CME, so continuing medical training. And he showed me the website. I saw like the general conference to be introduced to functional medicine. So I signed up for it and I went. And it was within the first hour of being there that I was like, I can't look at medicine the same. It was all taught from a physiology, a biochemistry level. Like everything made sense. Like I couldn't argue with what was being taught. I mean, I didn't understand why I hadn't learned that in traditional training, but it was just like, I can't argue with this. And then career-wise, I was about as young as someone could be there. I mean, I was just starting residency, and there was all these, professionals there, like neurosurgeons and ophthalmologists and orthopedics and all these people there. I'm like, what are you guys doing here? And they're like, this is the future of medicine. Like, if you're just learning this, if you're just starting, like, do this. And so I just kind of, I took a chance. I mean, I was mocked by my friends that were in medical school. I think my parents thought I was nuts. What I did have was a very, very supportive family medicine residency coordinator, my director, Dr. Friedman. Because I went back and I was like, I'm really interested in this functional medicine. I want to pursue this. He's like, sure, whatever you need. And so it was during residency that I went and did away rotation. So they let me leave my residency program for like weeks at a time to go train at these other facilities. So that's where I trained at Dr. Hyman's clinic, Dr. Chopra's clinic, Dr. Blum's clinic. And I was just like a sponge. I had notepads and I was just following everybody, the doctors, the receptionist, the life coach, the health coach, the nutritionist, just learning from everybody because everything was completely different than what I had been taught. And so that's how I got into it. I mean, and I say it's luck. I mean, the majority of physicians in our field that get into functional medicine, it's usually because they got sick and they couldn't get better. So they found this other way. For me, I got sick, but it was more of like, I guess, a mental illness. But that taught me about how to heal people or help people heal.
Yeah, I'm going to take tally as we discuss things because, uh, when I came up with my nest and rope acronym, it was rooted in the functional medicine tree and the roots. And I just tried to figure out a way to remember it. I'm just trying to really pass the test. And I was like, wait a minute, this is catchy. And maybe I can use this as my foundation.
Yeah.
And I do feel lucky. I think you got lucky. Unfortunately, uh, because you were sick, but man, why not discover that at the beginning of your career? And I think all of us would have been lucky to have done that. My journey was, family member gets sick, and then I had issues with my stomach, irritable stomach issues, may have been leaky gut, who knows? But I just know it got better when I started to focus on lifestyle. So as we have our conversation, I'm going to think about my acronym and see where you've already touched on trauma and how your life experiences teach you that maybe what you thought was true before is not, and maybe your emotions and your spiritual journey and your mental health is more important in these other areas. So thank you for giving us a little bit of that. And I do want to go into this idea of the gut a little bit. And we know that your gut is so important. And I couldn't even just be a happy camper with a stomach that was always irritable and so sensitive. So I want to talk a little bit about, why the gut is so critical for our health and the risks that, prevent us from having a healthy microbiome. I just want to talk a little bit about what types of things mess our gut up in the first place and why is our gut health so important?
Yeah. So I want to start with just saying that in your acronyms, NEST and ROPE, I counted 4 out of the 8 are related to mental health, mental, emotional, and spiritual health.
Yeah, true.
And that to me just made me smile because that's the key, right? So this is a spoiler alert, but the Unfunc Your Gut, my book, the big secret that I reveal is the most important part of healing your gut is your mental, emotional, and spiritual health. So that's when I look at your
Yeah.
acronyms, NEST and ROPE, I'm like, okay, this makes sense to me. Um, and I mean,
Yeah.
I'll tell you a little bit about how I got there, how it's connected to the gut. Because I think that's probably so. There's a couple crucial things to understand the gut, right? And Hippocrates 3,000 years ago, he said all disease begins in the gut, and that's before we had stool testing, urine testing, breath testing, all these different labs, all this
Mhm.
knowledge, right? Um, he knew this 3,000 years ago, and the craziest thing about that is since he said that, everything we've done is damaging to the gut antibiotics, meds,
Right.
stress, genetically modifying our food supply, sugars, fake sugars, like all of this stuff that we've come up with is destroying our guts. And it's crazy to think about that. He knew this and yet we've gone the other way. So the most important role to me of the gut is that the gut is the gateway into your body. So the gut is a tube
Mhm.
that runs from the mouth to the anus. It has openings on both ends. So not a lot of people think about it this way, but technically the inside of your gut is considered outside of your body. If
Mm.
you swallow something and poop it out, it's never been in your body. So the gut's most important job, in my
Mm.
opinion, is to decide this should come in, this should stay out. And so that's where that term leaky gut comes in. When your gut is leaky, anything you're being exposed to can get into your blood. So on the other side of the tube is the bloodstream tube. And once we digest, absorb food, we should also, so the absorption process happens in the small intestine. And that's where a leaky gut happens. And that small intestine has junctions that open and close. They let nutrients in, they keep toxins out. When the gut is inflamed due to meds, diet, stress, et cetera, those junctions stay wide open, and that's leaky gut. And so the function is just like your skin, right? But people wash their hands all day long trying to prevent infections, but then they throw anything in their mouth for to eat, and that barrier is so much thinner. Like the gut barrier is so much thinner than the skin, and so that's why you could take people with gluten sensitivity or SIBO or dysbiosis or gut issues, and they all have different symptoms. You could see it present as headaches, migraines, joint pain, rash, eczema, autoimmune disease, autism. All these different conditions can be connected, starting with the gut health. And then so the inside of your gut is outside of your body. And then the second most important thing about the gut is the gut brain connection. So that whole tube that we're talking about is lined with a nervous system called the enteric nervous system. Has over 200 million neurons in it, more than your brain does, right? So, and that nervous system surrounds your gut and it communicates with your brain. So your brain sends signals down to your gut sends signals up to your brain. That's your gut brain connection. Those signals run down something called the vagus nerve. We have 12 cranial nerves, which are nerves that basically run from our brain to different places. And the vagus nerve is one of your cranial nerves that runs from the brain to the gut, to the heart, to the lungs. The vagus nerve is the key to your gut health. It runs on your autonomic nervous system, which is your automatic nervous system. So these are responses that you're not thinking about, they're just happening subconsciously. And that nervous system can either be in two responses. It could be in sympathetic response or parasympathetic response. Sympathetic is fight or flight, right? That's when I live in Montana now, and the analogy I use is you're hiking in the mountains, you see a grizzly bear, your sympathetic nervous system is activated, fight or flight. The blood goes to your brain, to your muscles to escape, right? And then at the end of the day, you sit by the campfire, and if you're having s'mores or whatever, you're in parasympathetic, rest and digest. So you're sending signals from your brain to your gut that, hey, it's now time to break down my food, absorb it, and the gut is nice and active. Mm-hmm. The problem with the world we live in today is that we are living as if we're running from a bear 24/7, right? And I'm guilty of this myself. Like the first thing I do when I wake up is check my phone, right? And it's email and text and the news, and my sympathetic nervous system is just firing, right? And then if I make breakfast and during breakfast I'm reading the news or watching the news or answering emails, same thing. I'm sending signals to from my brain to my gut that say, hey, it's not time to digest the food. And the gut's confused because like, well, you're putting food down here. But the brain can overpower that. And that to me is the key to gut health, because when that happens, and for a lot of us, like it starts as trauma, right? And trauma, I mean, the best definition I've heard of trauma is anything less than nurturing. And most people think of trauma as experiencing like violence or something like that. Trauma can be just not getting enough attention as a kid, right? You come home from school, you're trying to show your mom your homework or something, and mom's cooking or working or dad's working and they're not paying attention, right? Well, that could create signals that say, I'm not good enough, right? And then when you're doing that, it's shutting down your gut. And that allows the wrong bacteria to take over. That stops you from digesting. That makes your gut leaky. All of that stuff can accumulate over time. And that could present as disease 5 years down the road, 10 years down the road, 40 years down the road. But for so many people, it starts as like this, what a lot of people wouldn't even consider trauma, but trauma, which activates your sympathetic response in your vagus nerve, which destroys your gut. So that is why dealing with mental, emotional, and spiritual health is so important. And I talk about it so much because it's when people come to see a functional medicine doctor, or at least me, they're expecting to get a strict diet, they're expecting to get supplements. They
Hmm.
don't expect me to talk about their mental health. And they put up huge red
Right.
flags like, hey, like this is not an issue. Like, and as someone that lived in denial for a very long time, like you can see it like when someone's doing that. And it there's I'm very blunt and honest with people, and I'll usually tell them like, unless you can come around on this and start digging into what is actually going on mentally, emotionally, spiritually, you will never get better. You can follow the strictest diet, do all the right testing, take all the supplements, and you will not heal. So those are the two most important things I like to teach people about why the gut, that's where disease begins, because it's the gateway in, and it's so affected by our mental, emotional, and spiritual health.
Yeah, very few of us have thought about, how we start in our mouth and we end on the other end as kind of a gateway. It's like the outside on the inside. And it's like a very interesting way of thinking about things.
It's like a
And
long highway running through you with
it
that.
really is.
Yeah.
And you're right. That I mean, having looked at intestines, I remember being in physiology and literally having intestines in your hands with a pig that was sedated. It's not much to it. It's like growing up eating chitlins, right? But when you look at what that is, it's very thin. Having done some obstetrical surgery, the bladder very thin. It's actually amazing that the human body can live for 100 years, and when you think about what we're made of,
Yeah.
it's not much. So
Right.
it's pretty deep, and I just like how even how you talk about fight or flight and things like that. What I'm hearing just from a functional medicine perspective is just a different way of looking at things, and to be honest with you, um, if it had not been for exposure or having a moment where you had to reflect in your life, I had a moment when I had to reflect. It forced me to think outside the box. And my hope is that we'll eventually get to the point where this just is incorporated into the regular training of the average physician. So it's not so unconventional and it becomes more conventional, because I think that if we're problem solvers, we have to keep peeling the onion. And if we know that maybe the emotions are the reason, or the mental health of a person is the reason why they're sick, then we can actually help them. If we don't know that, then we're just kind of, it's PMS again. We're doing the procedures, medicines, and surgery. So all of that really resonates with me. And I thank you for, sharing insights like that. And just a couple of more comments about the gut and emotions. I know that, I've heard that rumor that, things like serotonin, for example, are made down there. So could you comment a little bit about just how, there are things that are being made in the gut that really affect our emotions?
Yeah. So the majority of your neurotransmitters, like dopamine, serotonin, are made in your gut. And you wouldn't think that, right? You think they're all coming
Right. I
from the
mean,
brain, right? It's
right.
crazy. And so some people call it like the second brain, right? They refer to your gut as your second brain. It's arguably almost your first brain. I mean, it's arguably almost just as important. Um, but yeah, I mean, the gut has so many different roles that I guess we don't think about. I mean, the majority of your immune system is in your gut, right? And we've all, I mean, for the last year and a half, we've been kind of presented with how important having a healthy immune system is, right? And if we're
Yeah.
feeding that gut tube just chips and fast food and just zero nutrition and just straight inflammation, how can your immune system be healthy, right? So the immune response, the nervous response are huge parts of the gut that, but they're affected by what you're putting into it too, right? So you can't put
Right.
junk into it. Like you're not going to pour like water into your gas tank and expect your car to run. So, if you put a bunch of junk in there, that's what you're going to get. You're going to get a junk response back. You're going to get disease. You're going to feel like crap. And, I mean,
That's
that's
right.
all our body has to run off of is what we put into it. Right. So, I mean, our cells are capable of making some things on their own, but they need help. They need the nutrients from food to help make those things. So it's,
Yeah.
if like we talk about the microbiome, and then when you have dysbiosis, the wrong kind of bacteria overgrowing your gut, some of those bacteria can actually block the dopamine. So your depression,
Mm.
anxiety could actually be stemming from the gut. And I mean, as much as I talk about mental, emotional, spiritual health, there's also, you have to work on the gut health at the same time. Like it's definitely a
Right.
two-way
Right.
street, right? So it's not just your mental health, because you'll meet people that are like, listen, like I'm exercising, I started therapy, I'm doing meditation, yoga,
Mm-hmm.
but like my gut still feels like crap. And that's because they didn't address the SIBO or the dysbiosis or whatever. So
Right.
it's it's
Yeah.
it's
It's so
crucial to
so
focus on
many
both
people I see.
parts.
You have to, and that's why, again, that's why we have a nest and a rope, right? So
Yeah.
there's gaps. There's going to be some gaps in your life, and I tell all my patients, let's figure out where there's gaps. You may be doing a great job in one area or in maybe most areas, but where there's gaps, if you don't fill those gaps, you're going to continue to struggle, and you got to have a healthy stomach. And a lot of patients that I see, if we just blanket, just make their diet better, less, refined foods, less processed food, less sugar, a lot of times everything else gets better. And we've had so many guests, Dr. Ken Berry, Dr. Kristen Bear, a patient, Monique Travis, and they were treating other things, and the emotional part just got better. It was just magical, and they weren't really, it was like a bonus. So
Right.
I really think that it's important that people understand your gut health is important, and we need people that help us, show us how to make it better. So I did have a guest in my last podcast episode, Dr. Michael Foggs, who is, previously the president of the College of Allergy and Immunology, and really bright guy. And he talked a little bit about, I was almost afraid to ask the question about leaky gut, because he was a conventionally trained doctor, at Harvard and Yale. And I was pleasantly surprised when he said he was aware of what leaky gut was more recently, and things of it. So I was very, very happy about that, because that's telling me some of this stuff is going mainstream. So we're getting there. So you're not going to look like, some weird guy anymore, and I think that's great. So, and I won't either, because that's the training I'm getting. So your thoughts on why food sensitivities have become so problematic and prevalent in our society? It seems like everybody's having issues. So talk a little bit about that.
I think it's mostly because of what we've done to our food supply, right?
Mm,
They've changed our food. It started with like the hybridization of wheat in the 1950s, and now it's transitioned into the genetic modification of food. So, what that means is that they're changing the proteins, right? Well, the proteins of those foods are what get into our body and support us. And so when something
mm,
crosses the gut barrier and into your blood, what's hanging out in your blood is your immune system. And your immune system is used to seeing gluten look a certain way. But now all of a sudden it's coming in and it looks different, right? So it's actually an appropriate response. It's a good response. The immune system's like, "Hey, this is not good. I got to get rid of this." But the problem is that you go to the store and the majority of the stuff you're buying is filled with that stuff, right? And so you
mm-hmm.
take like animals, right? Like cows. Like cows used to just roam around in grass fields. Now they keep them isolated. They feed them
Mm-hmm.
these crops that are genetically modified, they're not out there roaming. So their proteins have changed. Then they shoot them up with medications, antibiotics. So those proteins of the beef is different, and the milk is different. And it's inflammatory to some people. Like some people are looking at, their immune system is looking at it and saying like, this is no good, get out of here. Soy, over 90% of soy in America is genetically modified. Corn, over 90% of corn is genetically modified. If you're eating the standard American diet, which we call the SAD diet, it is mostly made up of gluten, soy, and corn, or animals eating those things. And all of those foods are different than they used to be. And that, I think, is the biggest, that on top of all the stuff we're doing, like antibiotics, medication, stress, because you're more likely for that to develop if your gut is leaky, right? So we start by giving
Mm-hmm.
kids antibiotics at 6 months or after they're born or whatever, and that's starting to damage the gut. And so now if your gut is leaky, you just have a higher chance, and then you're throwing all this crap in your body. Much higher chances for your immune system to finally say like, I've had enough, like you got to stop this.
Yeah, and it's pretty sad because our parents don't realize it. It's so easy to um, have a sick baby, and you go into a busy office where you have a 15-minute appointment, and man, just throwing an antibiotic at it just is so easy to do, and the downstream effects were not really taught anymore. It's so easy to put a bottle in a baby's mouth instead of breastfeed a baby, It's like, and I'm sure the breast milk is so much better, than the bottled milk. So it's a lot of things that we kind of do to ourselves um, that we could do better. And it's not that we don't know. The data makes it clear that a breastfed mom, as an example, is going to have a baby that is going to do better. But, sometimes out of convenience or lack of knowledge, we make different decisions. But I know it's nice to get mom's bacteria in the baby's body, and I think that's really critical. So, and speaking of bacteria, my wife wanted me to ask you a question. It was related to probiotics, and uh, you know, over the years, before I started eating, I tend to be more of a low carb guy, but before I started eating a slightly different dietary approach. I wasn't, stop eating the SAD diet, right? The standard American diet. I actually did pretty good with probiotics, right? I would have, I had the irritable bowel issue, and it was much better with that. Now I can pretty much survive without it. Although, so her question was, and my question is, from your perspective, we've already I know when we made a short video about SIBO, we talked a little bit about with small bacterial, overgrowth. Sometimes probiotics can make it worse if it's too much bacteria, good or bad, is a problem. So if you take the average Joe, the average person who is doing okay, but have heard that probiotics are a good thing, is it? So, rather pre or, biotics or regular probiotics, what's your thoughts on this idea of taking them, just like taking a multi or something? Should people be taking probiotics? Should they, if they're feeling okay? What's your thoughts on that?
So this might be a shocking response from a gut doctor, but I'm actually not very pro probiotics, and a couple reasons why. The best thing we know about your microbiome is the more diverse it is, the healthier it is, right?
Mm-hmm.
And when you're taking a supplement, you can look at the label and see exactly what species they put in that bottle. And it's usually within the phyla of
Right.
Lactobacillus and Bifidobacterium, right? And then there's all different species
Yeah.
within those. You're getting such a limited growth of bacteria. Whereas, like, if you made your own sauerkraut, or had some kimchi or something fermented, or like a yogurt if you're not dairy sensitive, you're getting like trillions of different kind of bacteria. So
Yeah.
that's one of my biggest problems is like, if the end goal is to create diversity, you're not really doing that with a probiotic at all. So one of the things, like, I mean, I have patients that are like, listen, I want to stay on a probiotic. One thing that I tell people is make sure you change the brand, the company every month. Every time you finish a bottle, try to find something completely different. Unfortunately, most of them still have the same combo of bacteria. They just have a different company promoting it. So I would 100% recommend to people to do it through pre and probiotic foods. That's what I always focus on. And then one way to also handle it is to keep a probiotic on hand and use it as needed, because I think that's how supplements should be. Like, we don't need supplements to survive. Like, they're as needed. And so the way I say it is, like, if my diet sucks, like if I'm not eating any fermented foods, then I would take my probiotic. If my diet has pre and
Yeah.
probiotics in it, then I don't need it. Right. So, like, for example, is like when you're traveling, right, it's harder to eat healthy. So that's a good time to maybe take a probiotic. The most common thing that I treat is SIBO, which is an intestinal overgrowth that we talked about of your small intestine, your bacterial overgrowth of your small intestine. A lot of times people who have SIBO actually get worse from taking a probiotic. So that's where I really, I have access to the testing. I'm a very objective person. So I like to run tests. I don't like to guess. Like, I want to do a stool analysis, look at what's growing in your microbiome. And yeah, if it's really poor, like if you don't have a lot of stuff growing in there, then I will use a probiotic for a few months to try to help stimulate it. But I actually prefer prebiotic supplements over probiotic supplements. Prebiotics are the foods for the bacteria. So I think you're better off feeding them than just putting the same stuff in over and over.
Just
So
putting them in.
I know that there's different opinions in the functional medicine world. A lot of doctors think that everybody should be on a probiotic. That's not my opinion.
Yeah. And that's okay, because that's why we want to get enough information in front of people from reliable sources. Any good scientist has to take data, form an opinion. We don't always have all the data to make a decision, so we make the best decision based on the evidence. And so there's going to be some variation, but I do think that makes sense. I can tell you from personal experience that I don't think you have to take it either, because I've learned from personal experience I don't. But I do. But we recently purchased some, and we'll probably take it for a little bit and probably stop again, just to kind of, so, and there's reasons why you would or wouldn't do it. But I do agree that I like your perspective, which is, hey, if you can get it from the food, we always want to feed our body with food if possible.
Right.
Whether we're trying to heal and not take medicines, let food be thy medicine, or we're just trying to fill our gut with the right bacteria so that we'll have a healthy gut that's not leaky. So I think anybody listening can resonate with that. And that makes a lot of sense. And speaking of diet, a lot of people listening to this podcast, they lean towards carb restriction a little bit, which is kind of a tough sell when you're in a master's in nutrition program, right? It's like, and it tends to have a lot to do with a plan approach, So that's one thing that's been always a interesting thing for me to kind of wrestle with. But having said that, a lot of my patients, because they were eating a standard American diet, they become metabolically healthy because they're eating completely different, rather it's meat or not. So I think that's an interesting thing. But I know you mentioned the low Fodmap diet. Again, I hadn't learned about that diet until I started my training. I hadn't even heard of it. So I want you to talk a little bit about what a Fodmap diet is, and and I noticed though when I looked at it that it kind of in some ways is low carb because you get rid of a lot of the things that are carby. And so I want you to explain what that is, but then I also want you to kind of comment on, you know, in some ways I feel like a low carb person is doing a low Fodmap diet, more long term, and just your thoughts about what that means to you versus, how you were trained, how you've internalized that information. So talk a little bit about that so people know what that is.
So a low FODMAP diet is basically a diet where you're avoiding highly fermentable foods, which are the favorite foods of your gut bacteria. So more than anything, what I'd like to say is that a low FODMAP diet is not a healthy long-term diet because you're starving the gut bacteria. It is a great thing if you have SIBO. So the only time I recommend a low FODMAP diet is for somebody with small intestine bacteria overgrowth. It is a way, it starves the if you're not eating those highly fermentable foods, your gut bacteria are alive. If they don't eat just like you, they die. So by avoiding those foods, you are not feeding the gut bacteria, which helps you get rid of the SIBO. So my approach is always to do the low FODMAP diet for as short as possible. As soon as someone's SIBO is in remission or they're feeling better, I like to bring the Fodmaps back in. And so the Fodmaps, they're different subclasses, but some of the main ones, the two most difficult ones, in my opinion, to avoid are garlic and onions, because it doesn't matter if you're from Europe or America or Asia or South America or Africa. We all use garlic and onions to flavor our food, right? So it's hard to cut garlic and onions out of our diet. Avocados are eliminated on a low FODMAP diet. That's personally like my favorite food. Avocados are a superfood, so that's another one that's hard to eliminate. Apples are cut out. A lot of healthy nuts are cut out. Dairy products are cut out. So it's it's an amazing diet to help someone get rid of SIBO, but it's not a good long-term diet because we care about your large intestine. We care about your microbiome. The problem is we can never heal your microbiome if your small intestine doesn't get healthy. So you need to address that first because that comes before your large intestine. So if things pass through and your small intestine's inflamed, then nothing good's going to happen in your large intestine. So low FODMAP is used to treat SIBO. It's a great short-term diet in that scenario, but not a good long-term diet.
That's fair. So let's get a little bit more nuance. And this is I'm definitely a big fan of bio-individuality. So when you think about, I mentioned Dr. Kim Berry as an example, Dr. Kristen Bear. So they're carnivores, and a young lady, Ada Fox. She calls herself the Black Carnivore, and she has a large community of color, and they kind of engage that community and learn about that type of dietary approach. And so my nutrition and functional medicine training, really focuses on the need for fiber, which definitely is consistent with, what you need to feed your gut bacteria. And but the struggle is that you have some of these carnivores who, maybe the oxalates and the phytates and the things like that in plants bother them. And when I talk to some of them, they'll say, man, if I eat this stuff, it makes me sicker, and they can't tolerate it. And then I think about Eskimos and how they don't eat a lot of plants. So I know in my training, it's like this emphasis on fiber. And what I do is I say to my patients with low carb, I say, well, spinach is fiber. So you can actually get your fiber from a low starch, a low starchy version. But then you have these carnivores, and I know that I know there, some people are going to be doing research on that. to understand what that really means long term. But, so I guess my question is, how do you reconcile this need to thrive on fiber, but yet you got carnivores who can't seem to eat that stuff? So what have you seen in your practice? Do you have any carnivores in your practice, or people who eat a lot of meat? And what have you seen? What's been your experience with that?
Being a gut doctor and as being the condition SIBO, the most common one that I work with, my working theory is that people that really feel better on a carnivore diet are people that have had SIBO, because you're kind of following a low FODMAP diet. And I mean, I would love to run a study and test people for SIBO before they went on a carnivore diet.
Right. Right.
I'm personally not convinced that's a good long-term diet. Again, because I don't think it's healthy for your gut, and I'm a gut doctor, so that it just doesn't match up. I'm also not going to argue that for some people, maybe it is the right diet, right? And that's one of the difficulties I think we have with nutrition is different things work for different people, right? Because you can sit there and talk to a carnivore,
Right.
but then you can also, like, my best friend's a raw vegan, right? And which is like the total polar opposite. But he had migraines,
Right.
he had IBS, he had all this stuff, and swear it's like 5 years that he's been raw vegan.
And he's thriving.
Thriving.
Right. He's
Right.
thriving. That
Right.
you can't argue with that.
And I'll try to
Yeah. And by
do.
the way, the Society of
Go ahead.
Well, I was just saying the Society of Metabolic Health Practitioners, they purposely kept it as metabolic health because of what you just said. So if you're metabolically healthy and you're a vegan or you're a carnivore, at least for what we can see now, where I guess we can't argue with that. So I think that's a healthy approach, which is there's an approach that's probably good for most people. And then there's an approach that we have to do for some people, depending on how they respond. So the best experiment is N of one. So
Right.
whatever your body tells you is going to give you the best answer. So, okay, but you want to have some more comments?
Whenever, like, my friend John, whenever we're together, like if we travel somewhere, I'll be like, all right, for this weekend, I'm going to go raw vegan with you.
Mm-hmm. Right.
I don't feel great and I don't really enjoy it. Like I like food cooked. Like I usually don't make it to the third day without, like, all right, I'll eat vegan, but I'm going to get it cooked because I want something warm. Whereas he's just
Right.
fine, just munching on fruit and vegetables all day long, but it doesn't work for me personally. But I've experimented with it, and I
Yeah,
don't fight with him. I'm like, no, that you shouldn't do this diet. It's not what I believe in. If it's working
that's
for
right.
him, that's great. But I mean that, and then whichever person you talk to, they'll like defend their diet to the death, right? Like you have to
Oh,
be
yeah.
keto, you have to be paleo, you have to
Yeah.
be raw
We don't want to do
vegan,
that.
right?
Right.
And I think, I mean, again, and another thing that I really preach on is like mental, emotional, spiritual health. So if a raw vegan diet doesn't stress you out and you're relaxed, that diet's going to work better. Just like if a carnivore diet is not stressful to you, it's easy to prepare the meat, it's not a lot to think about, you're resting and digesting, that's going to be better than following what I would think is a good diet for your microbiome if that stresses you out, right? So there's so many factors that play a role, right? It's like the people you associate with. If all your friends eat meat, trying to go vegan is not easy. If all your friends are vegan, just eating meat is not going to be easy. So all of those things play a role in how your gut functions and how you're going to respond to the diet that you're on. It just takes experimentation, right? And if you try one and it doesn't work, then try another one. But you'll find what is right for you, and what's right for you today can also change, right? Like your gut health changes all the time.
That's right.
What diet is working for you, just because a diet's working for you today doesn't mean it's going to be the right one for you in 2 years. So just
Yeah,
keeping an open mind.
I agree 100%. I think that's it. Well, that's why we need the Black Carnivore 8-Day Fox, because for those who need that diet, you have somebody that gives them permission. Hopefully, Sean Baker will be doing research, because we do need to have some data
Right.
so that us clinicians who are scientists can say to a patient, 50 years from now, you're going to be okay.
Yeah.
you know,
Right.
so I think the more we talk in these terms, the better. I mean, what I like about you, which is why I have you on a podcast, because you are about root cause,
Yeah.
and I'm becoming what you became years ago when you started your journey, right?
Yeah.
And so I really believe in that way of thinking, but I also want to have people who are going to be respectful to, with each other, see the world through the lens of others sometimes, while also honoring the way we see the world. So I think all of those things are wonderful, and that'll allow us to have good dialogue about these topics, and really help people no matter what path they're taking. So again, I mentioned earlier that I had Dr. Michael Foggs on the podcast talking about pollutants, and so I want to just briefly talk about some of the negative effects of environmental pollutants from you.
Yeah.
What stuff is, we've talked about some of this already, but what other things come to mind that really pollute our body and cause us to be sick?
So toxins are the second most common thing I work with behind gut health. I'm known for gut health because of the book, and that's what I've done. But I honestly help people detox just as much as I help gut health, and that is because our environment is extremely toxic, right? They're introducing thousands and thousands of new chemicals and pollutants into our environment every year. And toxins should not be in our bodies. And so to understand toxins, we have to understand what detox is. And so toxins, when we breathe them in, when we drink them, when we eat them, they are fat soluble. So when they get into our body, they get stored in our tissues. What detox is the toxins pass through the liver, and the liver goes through this two-phase process called detox that turns those toxins into water soluble molecules. And then you pee, poop, and sweat them out. So peeing, pooping, and sweating is how you detox, right? And the tox, our ability, we all have a limited capacity of detox. So, you can't, I'm going to put like just an arbitrary number on it, but let's say my ability is 100 things a day. I can get rid of 100 toxins a day. In an average day, I'm exposed to 50, I'm fine. But then all of a sudden I start binge drinking, or my house floods and I've got mold, or I start smoking cigarettes. Um, or there's a bunch of lead in my water. Now I'm exposed to 5,000 toxins a day. My body can only get rid of 100 of them. So 4,900 are going to just keep getting stored and stored and stored until I stop the exposure. The other thing is that detox is completely dependent on nutrients. You need vitamins and minerals for detox to function. If you don't take in enough vitamins and detox, if your capacity is 100, but you're only feeding your body to a level of 50, that's as effective as it's going to be, right? So you need to put in the nutrients in your body to allow your liver to get rid of that stuff. And there's a lot of toxins, but there's two main subclasses that I work with the most. And one is heavy metals and one is mold, and which are both a huge problem all over the place. I mean, Chicago, where I'm from, a lot of mold, right? A lot of old buildings with a lot of water damage and mold problems. Pipes used to be made from lead. They put lead in paint. Lead comes out of airplane exhaust. So this stuff is everywhere, right? And the other problem is the way that our toxic load starts is that mom could pass them to you through the placenta. So you could be born with a bunch of lead in your body, or a bunch of mercury, or a bunch of cesium or thallium, because mom didn't have it detoxed, right? So we're heavy metal testing is probably the one thing that would be my number one, actually, probably preventative test, because we've all got exposure. So if I could just do one testing on people, like as a yearly visit as a family practice doctor, I would want them to do heavy metal testing. Because toxins, when they build up in our body, they damage they damage everything, but there's three main systems: your immune system, your nervous system, and your reproductive system. Just look at the issues with infertility right now. Men with low testosterone and women unable to conceive, right? Why is that? Why is that ramped up over the last 40 years? What's one thing that's happened? The amount of toxins we've released into our environment. And there's lots of studies showing like the effects of glyphosate on your hormones, right? So we're all being exposed. And so immune system, nervous system, reproductive system. I mean, what's the most common stuff that I work with is autoimmune disease, your immune system, nervous system, dementia, autism, reproductive system. The most common autoimmune condition is thyroid, Hashimoto's thyroiditis. The best way I've heard the thyroid described is like a sponge for toxins. So that's their favorite place to go, is your thyroid. So this stuff is everywhere. And we're all being exposed. And an example I love to use is I was working with a couple who came to me for multiple reasons, but they ended up doing toxin testing. And she grew up on the south side of Chicago, and he grew up in Nigeria. And they assumed that he would be through the roof, right? Because they don't have environmental protection the way we do in America, supposedly, right? We got their results back, and he came back completely negative, which I never see. And she came back through the roof, right? And that's just growing up in a normal neighborhood of Chicago. So they're everywhere. Mold is the other one that most people that are dealing with mold don't know that they're dealing with it. They don't know it's in their house. So my screening test for patients is not like, have you had mold exposure? My screening question is, do you live in, or have you ever lived in a house that has water damage? If you've had water damage, that equals mold to me. The extremely difficult thing for people to cope with is 99% of the patients I've worked with mold, it's only one person in the house is sick. So you'll hear a lot of times you meet with a spouse and they're like, I tell them, I think you have mold. They go home and tell their partner, and the partner's like, that doctor's full of crap because I'm fine and our kids are fine. So he's just making that up. Well, I've only had one couple ever where they were both sick and they were dealing with like a serious black mold problem, which, I mean, it was everywhere. But most of this is in our homes and we don't have any idea. And it might not affect you today, but it could affect you 10 years down the road. Because the analogy I really like to use in functional medicine is we all have a bucket. And we fill that bucket with mold toxins, with lead, with gluten, with sugar, with stress, with trauma, and eventually that bucket overflows. So what functional medicine is emptying that bucket. And the two most important areas without a doubt are your gut health and toxins.
Wow. Well, you're filling my bucket up above my neck with great knowledge. And I think the two nuggets, everybody should think about heavy metal testing. I jotted that down. I think that's huge. And again, that's not something that conventional docs think about at all. I was always shocked when I saw a study in my functional medicine training with mercury and how just a simple sauna, could just remove mercury. And I'm like, I told my wife, we need to get us a sauna. I just think that makes sense. So, and then the other thing is, you know, you don't have to have symptoms, but if you've had water damage, which a lot of people in Chicago
Yeah.
have,
Yeah.
flooding, right? Because
Yeah.
we have basements, right?
Right.
So you may want to get tested for mold. So I think those are good nuggets people can kind of walk away with, because those are easy things to, check. And then you can, and if necessary, we'll find a doc that actually can actually help treat those things. So I do want to,
I would make
yeah,
one
go ahead.
point that just your regular doctor, so you can't go to your family doctor or your internist or your pediatrician and tell them that you want heavy metal and mold testing.
Right.
They're probably going to
Yeah.
tell you you're nuts.
Right. Right.
So that's something that really should be done with somebody with training in functional medicine, because they're going to understand how to order the testing, how to deal with it if it's positive. It's just not accepted in the traditional medical community as an issue.
And I think what's important is that part of what this podcast hopefully will do is will give more exposure and people more comfort with using a functional medicine clinician, even if it's a second opinion, just to kind of tighten up those loose ends. And I think that we all should, I personally plan to have both, to be honest. So even though my wife has to make me go see a doctor, because I tell her I know what I'm doing. But we all need a doctor. We all need somebody who's going to get to the root cause, and a functional medicine clinician can do that for sure. Now, you talk a lot about in your book about the mind, emotions, mental health, spiritual health. So, does that mean we all need a life coach, a therapist, or something? So what's your thoughts on just utilizing professionals in that space to help us through our struggles?
Every patient that I've ever met, I've told to get a therapist.
Wow.
So that's the short answer.
Right.
The reason being, I mean, they're not going to fix your problems, right? I mean, they'll help you, but um, it's they help you figure out why. When did it start?
Mm.
What happened? Like for me, it took me a long time, a lot of therapy to figure out like why I was the way I was, right? And that's what a therapist helped me with. Um, I think they're a crucial part of healing. So like I said, I think we all should have
Mhm.
one. I have one. Um, people, there's so many stigmas, right? People are like, well, I don't want people to see my car in front of the therapist's office, that they're going to know there's something wrong with me. Um,
Mhm.
I personally, and I think we're all crazy. It's just either we're working on it
Mhm.
or we're not. Right.
Right.
And so,
I
um,
love it.
yeah, because a lot of times people are like, so you're telling me I'm crazy. And I'm like, yes, but I think everybody is. Um,
Right.
so
Right.
the mental, emotional, spiritual part, I always tell people, is the most important part of health, but the most difficult for like you and I to help someone with, right? People are seeing us to address the physical stuff. And so that's what I'm like, listen, like I'll figure out your gut, your toxins, your hormones, all of that stuff. But you need to make your focus your mental, emotional, spiritual health. And what works for me might not work for you.
Mhm.
Like I need exercise. Like I injured my back a week
Mhm.
ago. Today was the first day that I got to exercise. My favorite thing is basketball. So I went and played a couple games of pickup basketball, and I just feel better mentally than I have for the last week. And that for me, but that's not everybody, right? People are like, well, I get really exhausted by exercise, or I don't feel good. So they might do better with a longer meditation practice, or breathing exercises, or a different type of therapist. So that is something that is a lifelong journey. Um, it's something that I have to wake up and make a decision that that's going to be part of my health that every day. Because if I don't, then I just go right back to my old patterns.
Yeah. Well, I appreciate that, and I do believe, like the way I see it, um, you have teachers that give you knowledge and they share, and I think we all, as clinicians, are naturally teachers. You have mentors who share their experience, and you learn from the experiences they've had, and maybe like you as a a family doc who's now doing functional medicine, you can inspire some young docs to maybe have a similar journey, and you can share your journey. And you're doing that with this podcast. And then you have coaches, and what's cool about coaches is that they kind of do a little bit of both of those too, but they're more about, holding your hand, guiding you, not telling you what to do, but just giving you a sense of maybe this way, maybe they challenge you. And I think having a therapist, a life coach to partner with you through your journey is just a smart thing that you really can't lose. It just gives you another
Right.
perspective. And so I do appreciate that. And so we appreciate the coaching you've done today during the
It's an honor.
podcast. I think we all have learned a lot. And I do want to ask you about your journey. Of course, I have to ask you about my nest and rope. And when you think about the components of the nest and rope, do you have certain areas, nutrition, exercise, less stress, more sleep, how you think, relationships, organisms that you avoid that harm you, add the ones that help, probably avoiding pollutants, protecting your emotions, life experiences? So when you think about your journey, are there areas that you want to give extra attention over the next 12 months?
I think for me, I'm starting an elimination diet in 2 days. So nutrition, I incorporate intermittent fasting Mondays and Fridays. I do 24 hours. Um, and for me, as just someone in recovery, more than anything, it's my thinking, it's my relationships, it's my emotions. That's the stuff that I have to work on. Otherwise, I'm a mess. So
Yeah.
I've
Yeah.
addressed toxins. I've detoxed my body from lead. I've worked on my gut. I got rid of the dysbiosis and all of that stuff. So I would say I'm in what's a maintenance phase, which is just trying not to screw things up.
Right. Last thing, I was thinking about my nest and rope also. How much time do you guys talk about exercise when you're talking to your clients, your patients?
I would say I try to mention it to everybody,
Mhm.
but I probably don't spend as much time as I should on it. I mean, I wish I had like hours and hours, right? Because there's so many things
I
you could get
know.
into. But a lot of times, people that are seeing me, if I'm talking too long about exercise, they're like, "Listen, I'm not. I've had a physical therapist, or I've had a personal trainer, like,
Mhm.
or I've read books, or I've been working out my whole life." So, the people that come to see me are pretty active usually. Um, if I see that there's no
Yeah.
exercise, then there's definitely going to be a focus. But a lot of people already have some regimen and understand the importance of it. So, but I mean, it's huge,
Okay.
and it's something that definitely should be focused on.
Yeah. Absolutely. So thanks. I just wanted to get that clarified. I was looking at my acronym, and that's the only one we hadn't really touched on. So we're wrapping up. Obviously curious about any final thoughts, but more importantly, talk a little bit about how people can get your book or any other resources people can find you at.
So my book is Unfunc Your Gut, and that's funk with a C for functional medicine. It's on Amazon, Barnes and Noble, your local bookstore. There's a link to it on my website. My website is doc-koz.com, doc-koz.com. That's the best way for people to get a hold of me. There's an email and a phone number for my assistant, Jasmine. She kind of helps answer questions. She's fantastic. She's worked with me for a long time. So everybody comes into working with me from a different experience time frame, so she can help kind of get that figured out, what it's going to look like. So the what I tell people now is the initial visit with me is all education. Like I'm pretty much just teaching what I need people to understand. That's all in my book now. So if people check out my book and they contact Jasmine, they're like, "Hey, I read Dr. Koz's book." We can skip the initial visit and we can just order testing and we can get started because that education piece has already happened.
Nice. Um, Again, I was just thinking about your title, and I got tickled because you mentioned that you got Chicago roots. I'm in Chicago. You were more on the east side. I was on the west side, but we have something in common, and that's the rapper, the Brat. And the Brat, I thought about her song "Functified." So she made a I'm not making this up. So her wonderful book, So Functified. So I thought about you. That's where my brain grows.
Nice.
But she's literally also from Chicago. So us three, we're getting this message about making sure we protect our gut, and we're using that terminology that's similar. So keep that in mind. That's going to be on your brain from now on. You
My,
may even listen to the song later
yeah,
today.
I'm definitely going to.
Yeah.
We
So
used to
thanks
say
for
at my office, we put the funk in functional medicine.
that's.
So
I like that.
that's where it came from.
Hey, I love it, man, and I just love the catchy title. So thanks again for being here.
Thank you so
Really
much.
enjoyed it, and we're gonna wrap. Let me say a few wrap up comments, and today, guys, we learned from a doc who initially, was on a path to become a conventional family doc, and he found that it was okay to change directions. So if something isn't making sense or simply not working for us, it's okay to move in a different direction. He was able to, touch on so many aspects of the Nest and Rope acronym, which, should not surprise us because that acronym's roots are the functional medicine tree. And I jotted down a couple of the things we talked about. So the N, he talked about how nutrients help our liver to work better so it can help us detoxify. We just touched on exercise, and for those who are looking for a way to exercise, I did a great interview with Dr. Ben Bokikio, and he does 15 minutes twice a week, doing high intensity, training with bands. So I would actually go back to that episode and look at the show notes to learn how to do that. We talked about stress, and your diet is going to impact your gut, and it can stress you out if you eat the wrong diet. You don't want to eat a diet that's stressful. So we talked a little bit about that. We definitely talked about trauma. We started with that, and we tried to, our guest tried to help us understand that the trauma of being a young Polish kid was a lot for him, and it stressed him out a little bit, and it was a trauma to him. And he talked about how your trauma is really how you perceive it. It's not really about how other people perceive it. So what's a trauma to you is a trauma. We talked about relationships, and he talked a little bit about who you hang with matters, and it affects your gut health, ironically. We talked about organisms for sure, and how healthy bacteria will serve us, but too much of any kind of bacteria can harm us. So probiotics may be helpful, may not be necessary. Talked a little bit about SIBO and how you want to make sure the bacteria is in the right part of your digestive tract, in the large colon instead of the small colon. We talked about pollutants and how just exposure to alcohol can be a toxin to your body. And we must reduce toxin exposures, whether it's through a sauna or other methods. And we certainly should measure our toxins, whether it's through a mercury test or checking for mold. And we talked about emotions. And of course, the foundation of his book is that your life experiences will affect your emotions, your mental health, and your spiritual health. So a lot of lessons, really. Probably the first time I've had a podcast, it really touched on all aspects of the Nest and Rope acronym, and I appreciate you for that. So I hope the perspective of our guest today helped you better understand how important it is to find out, where you may be having gaps. So think about that nest and rope, and think about where you have gaps, and then and just use the knowledge that you're learning to fill those gaps and change in a direction that'll help you achieve your health related goals. So if you like guests like Dr. Kaz on the podcast, make sure in the Apple podcast to maybe review something or comment on something, and or in the YouTube video, just provide some commentary so we can get more guests with knowledge to fill our brains with those nuggets that we'll need to be successful. But what I really want to say is that I'm thankful to have this platform to spread the good news of healing and all the various ways that we can achieve our goals. So I hope you guys enjoyed today's episode. And as we conclude today's episode, again, thank you again, Doctor, for being here. And make sure you guys be safe, be well, and continue to protect your nest.